Welcome to Up Close, the research, opinion and analysis podcast from the University of Melbourne, Australia.
I'm Jennifer Cook. Thanks for joining us. How do you make a city safe? What can urban planners do to alleviate the fear that so many women feel when they have to navigate the streets at night or catch public transport? Can such a thing be done? And even if it can, how do you measure one's sense of well-being? In today's episode of Up Close, we are speaking to two women who have been instrumental in setting up programs to create cities that are inclusive and respect the rights of all people, including women, to live, work and move around without fear or difficulty. Dr Carolyn Whitzman is an Associate Professor in Urban Planning at the University of Melbourne, Australia, and she was instrumental in establishing the Gender Inclusive Cities project that is now running in India, Russia, Tanzania and Argentina. She's joined from Delhi via Skype by researcher and activist Dr Kalpana Viswanath. Kalpana is director of the UN-funded Gender Inclusive Cities project. I'd like to thank you both for joining us today.
Hello, Jennifer.
Hi, Jennifer.
Caroline, could I begin by asking to even tackle something like that as a woman, knowing sort of public transport and the fears you can have in different cities, just tell us how you got that mindset.
Well, I knew from my work as a practitioner, I was a planning practitioner for 10 years before I got my PhD, and I worked for the City of Toronto. We had a Safe City initiative in Toronto, and it made changes. It made differences in women's lives. We got improved design of public transport train stations, and the buses would stop at night between stops to let women off. We got a new grants program called Breaking the Cycle of Violence, and we had people coming back after a couple of years, the Breaking the Cycle of Violence grants from community organizations saying, this is how we saved women's lives.
What kind of violence do women experience in cities? Let's be really clear about it. Where does it happen? Is it more likely at certain times of the day or night? Kalpana, could I get you to talk to us a little bit about that?
Yes, certainly. This is really the focus of the first part of the Gender Inclusive Cities project, which is taking place in 4 countries. The aim was really to understand the nature of violence that women face in cities and how they dealt with it. So we found across the 4 cities, of course, there were some differences, but some of the main issues that came up really was the issue of lighting. So women did feel certainly that after dark, a city was much more hostile for them to move around in safely. The other issue was, of course, public transport, which came across in all of the cities, that women felt safe both while riding different forms of public transport and waiting for public transport on the roadside.
But Kalpana, in terms of the actual issues of violence, I think some of the statistics that came out of those baseline surveys were extraordinary. There's sexual assault, there's rape, of course, but one of the things that came out in really all of the cities that are doing this work is absolutely endemic and everyday experiences of sexual harassment. Kalpana, do you want to talk a little bit about some of that?
Yes. We did a survey across the 4 cities. In each city, there was at least 500 women who were surveyed for their experience of sexual harassment and violence on streets and other public spaces. And across the cities, it was interesting because over 75% of women said that just being a woman, just their gender, caused them to feel unsafe in cities. Across the cities, of over 70% of the women did say they had faced some form of harassment or violence while using public spaces. And this was less in some cities. The only city where we got less reporting was in Russia, partly because there is a reluctance to speak about sexual harassment in Russia. But in the 3 other cities, we did find very high levels of violence. The other interesting finding was really that women said they faced harassment both in the daytime and after dark. So while women certainly do feel more unsafe after dark, it's not as if the daytime made streets completely safe for women to use. And the spaces that they said they faced most harassment was on the road, while walking, at marketplaces, in parks, and waiting for public transport. So the range of public spaces that is available that is there in cities, women said across all of them, they did face harassment at different times of the day and different forms of harassment, as Carolyn said. Most of it was what we would generally say is sexual harassment, which is really staring, leering, touching. But we also got a fairly high rate in some cities of stalking, especially of younger women who said they experienced stalking really near their places of study or work or near their homes.
Caroline, I'd just like to make it clear which cities we're talking about.
Right. So there's 4 cities on 4 different continents, Delhi in India, Rosario in Argentina, Dar es Salaam in Tanzania, and Petrozavodsk in Russia.
There were these commonalities across the 4 cities. Kalpana, you've said that this reflects deep-rooted patriarchal attitudes that women are facing. Do you think that's the link here?
Well, most certainly. I think it is the issue of patriarchal attitudes, which seems to come across in cities across the world, because even other than these 4 cities, if one reads research in other countries, certainly it's there. I mean, there are special carriages for trains in Japan, for instance, which was a bit surprising to hear. And there's even research which has shown in Singapore that women face sexual harassment in buses. So I think somewhere the nature of patriarchy has some kind of commonality. Of course, it manifests itself in different ways in different parts of the world. But I think the most basic one of where women are really objectified. So when they're using public spaces, they are almost seen as fair game to be harassed or touched or felt up or whistled, stared at, is something that at that level came through. On the other hand, we also did get, though it was less, because this was a street survey, we did get a fair amount of women saying they'd faced more violent forms of sexual assault also.
This is Up Close. I'm coming to you from the University of Melbourne, Australia. I'm Jennifer Cook, and our guests today are Dr Kalpana Viswanath and Dr Carolyn Whitzman. And we're talking about gender-inclusive cities, making cities safer for women and everyone else too. Now, Caroline and Kalpana, we were just talking then about these attitudes of patriarchy, the sense that women are objectified and when they enter that public space that they're fair game. It's a sense of entitlement, isn't it? It's a sense of they're doing it because they can, they think they can. So how do you change that, Caroline, with good design?
Well, it's absolutely about the right to the city. And it isn't just design. It's a combination of design interventions and social interventions. And it's also the process as much as what gets built. So the main mechanism we've been using in the 4 cities of gender-inclusive cities, but also in cities around the world, there were 270 people at the 3rd International Conference on Women's Safety in Delhi in November 2010 from 40 different countries. So we're talking about a lot of different places that are talking about a lot of similar things. It's all about building relationships between community organizations, specifically women's organizations and local government, because people sometimes think it's all about laws or it's all about services. But when you're talking about prevention, it's about relying on the expertise of people who are living in the neighborhood, who quite often can suggest very common sense ways to improve the lives of women in the neighborhood. I'll give one example from Dar es Salaam. There was a big issue with a lot of women who were underemployed and who were using their houses, well, partly as sort of houses of prostitution. There was some informal prostitution going on, but there was also a lot of illegal brewing of liquor going on. Well, these women knew a lot about, and I know this is going to sound like a joke, they knew a lot about grain and they knew a lot about hospitality, and there was a lot of work done in Dar about getting the women to collectivize and make luncheonettes. Now, this sounds like a joke, but it worked. And the fact is that the women involved there knew that they were involved in some unsafe and illegal activities. And through working in a partnership, they were able to get more legitimate livelihoods that were safer for them and safer for the whole community. Just common sense stuff like that. So you can talk about lighting, you can talk about benches, you can talk about improved public service, public transport provision. But really, quite often, it comes to that kind of thinking outside the box that can only happen when you've got local women engaging with their local government. Another thing that came out of DAR is just doing a lot of work around basic public infrastructure, because in low-income countries, it's about there aren't any toilets here. That means I have to go out and find a railway line at 4 a.m., or there aren't any lights here, so I really can't see at night. There's no street numbers here, so even if I were to call for help, how could I get people there? So it's about working on some basic issues of basic level infrastructure.
And Kalpana, could you talk us through some of this ground level changes and strategies that you use?
Certainly. I mean, for example, if I take Delhi, we've had some very interesting kind of interventions at different levels. One of the ones which I think has been quite exciting for us has been in our surveys. One of the areas that has really come out very strongly in Delhi is where women face a fair amount of sexual harassment and feel a lack of safety was in public transport. And the bus system in Delhi is the largest form of public transport used by people. So we actually got an opportunity to work with the drivers and conductors who serve on these public buses. And as Carolyn said, the issue is really how do you get different stakeholders and authorities and service providers to take responsibility for the issue of women's safety. And I think this has been one of the key things to say that the onus of providing and creating a safer city does not lie on women's shoulders alone, but really on the different authorities in the city. So we actually trained. Jaguri did a kind of a gender sensitization training session kind of thing with almost 4,000 drivers and conductors. And this was then followed up by a review of this intervention where we got quite positive feedback from the drivers and conductors. And the next step was to do a training of trainers to then sort of mainstream this issue of women's safety and the responsibility and the role that drivers and conductors can play in ensuring a safer ride for women. So this has been one intervention, I think, which we can say has been quite positive for us.
This is Up Close, coming to you from the University of Melbourne, Australia. I'm Jennifer Cook, and our guests today are Dr Carolyn Whitzman and Dr Kalpana Viswanath, and we're talking about gender-inclusive cities. Now, Kalpana, you mentioned then taking that focus and the responsibility off the women and making it community responsibility, and it's a shifting of the burden, isn't it, from women being told they have to change their behaviour, they have to not go here or not go there.
Absolutely.
We talk about it as moving from dependence to autonomy. So the notion that women have to be protected by the police or protected by men in their lives and that sort of thing, towards a situation where women can be involved in planning, they can be involved in management, but more than that, it becomes an issue of partnerships, an issue of governance, and as you say, an issue of shared responsibility.
So how do we measure the change in a city's mindset? Is it even possible? I mean, it sounds like trying to catch water in a net, but you have specific tactics and methodology that makes this program work and make it measurable. Carolyn, could you explain that to us?
Well, what we're trying to look at are both process outcomes and impact outcomes. So in terms of the process, we're looking at new policies, possibly new laws or new bylaws. We're looking at new partnerships. We're looking at new training sessions like Kalpana just talked about with the Delhi Transit. In terms of impact, we're doing work in particular neighborhoods in these 4 cities. And in those neighborhoods, we're hoping to see an increased sense of safety and comfort in public space, and hopefully increased use and mobility in public space. And that includes public transport and includes all those kinds of public spaces. We have to be cautious because traditionally we've relied on police statistics which grossly underestimate the amount of sexual violence and harassment in public space. So we have been doing, as part of the baseline survey, these victimization surveys that Kalpana was talking about, and we will be doing doing follow-up surveys in a couple of years. So I want to be a bit cautious that this is a very big, very entrenched problem, and it's a relatively small and inexpensive intervention, so you can't expect miraculous results in a couple of years. But we certainly have seen the 4 cities that we're working in, we're already starting to do a little bit of this partnership work, and we've seen changed public spaces, we've seen improved policies and practices, and we hope that when we come to the end of the project this year and next year, that we'll be seeing some changes in women's use and comfort in public space, and also, of course, in that sense of empowerment, in the sense that you can make a positive change in your experience of the city, your right to the city.
Kalpana, in the work that you've done with these programs, what stories and experiences have stood out to you? What shows you that this program is working? Whose story do you remember?
Several stories. One is certainly the one that I told you, which was the drivers and conductors. We have also been trying to work, as Carolyn said, to really work with communities to get them to use the methodology of the safety audit as really a community tool to help people and work with people, empower to be able to assess their own safety needs and understand what causes them to feel unsafe. So in one of the neighborhoods that we had worked with young men and women, we had actually done a series of safety walks entirely done by the young women and men. And they had mapped their neighborhood. They had actually identified one of the main issues was the lack of space to play. So we had worked with the authorities and the municipality and the parks division to actually create a small park for them, cleaned it up, got trees planted and stuff like that for them to begin playing. These young men and women, we thought initially would begin to use this place for playing, but within 2 weeks of this intervention sort of seeming to be a success, we had the young women coming back to us saying, but the park is being used to play cricket by the boys, and we don't actually get place to play. So we went back and we had sort of a group discussion with the boys and girls to see how do we solve this problem. Do we sort of have different timings to use the park? Do we have ways of splitting up the park? So I think it was just fascinating, even for the young boys, young men, to recognize that their behavior and their actions actually directly cause women to feel that they don't have equal access to public spaces. So this has actually been a very interesting experiment for us. It was just in a small community, but really not just how women were able to articulate their needs, but how young men were able to understand women's needs too in public spaces.
Yeah, so the idea is hopefully you can come up with public spaces that can be used by all generations and both genders, and that kind of inclusive public space. That's why it's called Gender Inclusive Cities.
You're listening to Up Close, and we're coming to you from the University of Melbourne, Australia. I'm Jennifer Cook, and we are talking about gender inclusive cities. How do we make public places safe for everyone? I'm talking with Dr Carolyn Whitzman and Dr Kalpana Viswanath. Now, I'd like to ask you both, have you encountered opposition to these programs? And if you have, where has it come from and in what form?
Yes, of course, there's always opposition. And I guess the hardest thing is finding the place for women's safety. There is certainly a lot of work going on around the world around crime prevention and violence prevention. Sometimes it's hard to get gender inserted in more than tokenistic way, more than add women in one line and stir. I was actually dealing with a program document yesterday, an international, a UN program document, where I felt that after 20 years of this work, oh my God, we still have women relegated to a footnote. So there's that sort of macro level opposition. And obviously at the local sites, there's going to be a lot of discussion necessary. Kalpana was just talking about the discussion that happens with a group of young boys and young women, but there's also discussions that happen with local governments that go, oh, that's not part of our responsibility, or, police who go, that's not part of what we do. Our core purpose is to catch the bad guys and lock them up, kind of thing. So when you're engaging with the different partners, there's always a moment where people go, oh, is that part of what I'm supposed to be doing? And sometimes some resistance to that has to be tackled again and again.
How do you tackle it, Kalpana?
It depends where the resistance is coming from. If it's from the community, and often it can be, for example, how you privilege certain issues. So, for example, if you work in a poor community, you also have to be careful how you posit the issue of gender exclusion, because there's also exclusion based on class, based on race, based on income, which needs to be seen as valid an issue also in some cases. So one of the things we did in this project, in addition to really just doing a baseline, was to really identify who in the communities or who among the women are further vulnerable. And in each city, it was different. In some cities, it was based on income, certainly that. In some others, it was based on disability or sexual orientation or race, or where you live,
or
sometimes
age.
just age,
Yeah.
So I think for the community, I think one needs to also distinguish different kinds of vulnerabilities, because it's not as if all women actually experience a city in the same way. I think different women experience it differently depending on, whether you have to use public transport, where you live, where you work, do you have to go out at night, etc. On the other hand, if you have to work with the authorities, as Carolyn said, you get all kinds of responses which can come as obstacles, because often women's safety is not really seen as very high up on the agenda. For example, we did find if you're talking about rape or domestic violence, that's still something that has come on the agenda of a lot of governments today. But when you talk about really the everyday lack of safety and fear that women face while using the city, it's still a bit intangible, and there is a way in which it gets sidelined as an important issue. I would say what we've done is you use data, you use the voices of the most vulnerable to articulate their own needs. So I think that is important, rather than us becoming the spokesperson of people's actual experiences, and let the authorities and let the stakeholders listen and dialogue with the people who are actually facing the vulnerabilities while using different parts of the city.
This theme of making sure you're not only interacting with the communities, but really listening and hearing what they're saying and responding to, that's a very strong note throughout this program, isn't it?
Yes, the process is, in a way, one of the outcomes, that you actually have a kind of local governance system that listens to the needs of the people who are most vulnerable, and the assumption, as you said earlier, Jennifer, that a city that's safer for women will be safer for everyone. A city that's accessible for people with disabilities or children will be accessible for everyone.
You've articulated so beautifully how it goes far beyond just putting in a well-designed bus stop or better lighting or trying to change attitudes by a few slogans. Let's talk now about what has been the reaction of these women. What have been these positive outcomes?
I think it's really been exciting to see the kinds of issues that have sort of ring across the different cities. And just to give an example, I mean, the Latin American countries have actually, several of them have been working on issues of women's safety and gender inclusion for the past couple of years. And they have had really strong women's collectives formed in many countries, which are able to negotiate for their own demands and rights in ways which I think are very empowering for others to learn from. On the other hand, St. Petrozavodsk in Russia, this Gender Inclusive Cities project has been a catalyst for the issue. I mean, in our survey, we found that in Russia, a large percentage of women were not really willing to even answer questions on sexual harassment. So the challenge in some places is really to even establish that this is a valid issue and a problem that needs to be dealt with, whereas in some other cities, they've already moved towards very strong interventions. But really, I think for us, for me personally, as a director of this project, to see across the 4 cities the kinds of interventions which are being planned, which is in all 4 cities, it is really working with communities and working with the service providers, authorities, and stakeholders. And it's really hard work creating those partnerships and getting both sides to listen to each other. And I think that's, to me, as Carolyn says, it's the process, to measure impact and actual change in 3 years is a bit ambitious. But if you can actually begin the process of raising that awareness, making it an issue, The fact that it's reported in the media across the 4 countries is, to me, very significant.
What do you see as the way forward for the program? What's the next step?
Well, this program, the Gender Inclusive Cities Project, is a 3-year program in a manner of speaking. Of course, a lot of the interventions that begin, we are hoping that they will become sustainable in some way through the partnerships that have been created. But it is also, in a sense, rolling over into the UN Women's Global Program for Safer Cities, which is going to be launched in 5 cities this year, of which one of the cities, New Delhi, is overlapping between the 2 programs. And that program aims to actually create some kind of evidence base to evaluate impact in terms of programs and interventions and policies in each of these cities. And this is envisioned as a 5 to 7 year process, understanding the fact that bringing about social change takes time and cannot be seen as something that can be done in a couple of years.
So it's a program that's firmly grounded in a context with support and a way forward.
And it's just moving from strength to strength, which is really exciting.
Thank you both so much for your time.
Thank you.
Thank you, Jennifer.
You've been listening to Up Close, and I've been speaking with Dr Kalpana Viswanath and Dr Carolyn Whitzman about the Gender Inclusive Cities Project, how we make cities safer for women. Relevant links, a full transcript and more info on this episode can be found at our website at upclose.unimelb.edu.au. Up Close is a production of the University of Melbourne, Australia. This episode was recorded on the 2nd of February 2011 and our producers were Eric Van Bemmel and Calvin Parham. Audio engineering by Ben Loveridge. Up Close is created by Calvin Parham and Eric Van Bemmel. I'm Jennifer Cook. Until next time, goodbye.
You've been listening to Up Close. For more information, visit upclose.unimelb.edu.au. Copyright 2011, the University of Melbourne.